My name is Deborah Rose. I'm a GP. I am a Principal Clinical Teaching Fellow here at the University of Southampton. I have two key roles here. I am Director of the GP Teaching, which means I lead the team of 4 other GPs responsible for coordinating GP primary care placements. And I'm also the Deputy Programme Lead for the BM5 programme. Southampton has had a long tradition of encouraging early patient contact for students in general practice, and we place students in the first 2 years of all the programmes out in the community in small groups with their GP teachers. And in those placements they start to learn basic history taking skills, examination skills, and develop those over the first couple of years. Later on in their programmes, students spend longer periods of time, depending on the programme, 6 or 8 weeks in some of the years, in practice placements. And in those placements, they start to have a lot more detailed involvement with patients, both taking histories, examining patients and learning about patient management. Southampton students get to spend time in a number of placements across the region, and we place students as far afield as Dorchester, Jersey, Windsor and Chichester. So there's a range of places and opportunities for students to spend different times, both in different practices, in different types of practice, and in different centres for their learning. One of the key things we've introduced in Southampton recently is a placement for students to spend time as a healthcare support worker. And all our students in the second year of the BM5 and BMEU and BMIT programmes have a chance to work on the wards in the acute trust here in Southampton and really get to grips with what's going on wards and spending time with patients and caring for patients. The feedback from that has been really, really valuable, that students have learned a lot about patient care. I think it's really important that the 5 of us who lead the GP teaching here are still practicing GPs, so we have an understanding of what's going on in primary care, and for our GP teachers in the community. This helps us both in developing our curriculum so that it fits what's going on now within the NHS and primary care. So for example, we've included in our final year curriculum a mini symposium where students will get to meet academic GPs and look at some of the research that's going on in primary care. We have a very active research department here in Southampton. In terms of also the fact that we're practicing GPs means that we can make sure that what we're teaching our students is really relevant to what they'll be needing in the near future when they are qualified as doctors.